Rather than having made prudent life choices all along, most of us tend to only seek healthful solutions once we've had a scare in the form of a diagnosis or event. This is Healthscape with Dr. Trevor Campbell. In this program, we'll show you the techniques, innovations, and holistic ideas that you can use to put yourself on the path to better health. Now, here is Dr. Trevor Campbell.
Hello, and welcome to Healthscape. I'm your host, Dr. Trevor Campbell. Today's topic is chronic pain and how to empower yourself. The nature of chronic pain is still way too poorly understood by the public. Many people, including a good deal who suffer from it, see it merely as the persistence of the more common sudden onset or acute type of pain, rather than a distinct disorder or disease, complete with brain changes that can be seen on special imaging like functional MRIs. Much of the solution lies in the psychological and social aspects, and experts agree that this has to be an essential part of the treatment plan in order for recovery to occur. It also dictates that many of the changes and much of the work needs to be made and done by the patients themselves, as the term psychosocial encompasses a great deal, namely one's entire life appreciation and experience. More plainly stated, the treating physicians simply can't do it all. Our guest today is Dr. Carl Zars. A brief bio follows. Dr. Carl Zars, owner of Idaho Spine and Pain Management, Empowering Solutions, and Immunex2, is a double board certified physician in anesthesia, the American Board of Interventional Pain Physicians, Advanced Interventional Techniques, and is also a regenerative medicine specialist. He is best known for empowering men and women over 40 years of age by teaching them to age with power, especially when living with chronic injury or pain. Dr. Z's passion is helping his patients outmaneuver aging, and flipping the chronic injury script, whether a lifelong athlete or someone needing help turning back the clock. Dr. Z breaks down the science to show you that simple home-based tools and techniques will get you sleeping, stretching, strengthening, and energizing, as well as showing you the easier way to build your immunity, muscle, and recovery via supplements, superfoods, and more. Dr. Z's practice in Idaho Spine and Pain is also the developer of Immunex2, a strategic supplement, and Enhance X4, a concentrated organic 8 superfood nutritional powder. Dr. Z, welcome to Healthscape. Glad to have you with us.
Thank you. That's great to be here. I really appreciate you having me.
So chronic pain, as we know, affects about a quarter of the population in advanced or so-called aging Western countries. Yet, even with this huge prevalence, it has historically been poorly taught at physician undergraduate level, by and large underfunded, and many of us find it odd that it has never ever been proclaimed a public health crisis. Why do you think this is the case?
Well, I think that it's really been recent developments that we're actually starting to understand how pain works and the physiology behind pain. If you go past 20 years, even back when I was in medical school, we were taught that the central nervous system is static, that there is no changes, and there's no way to alter it. And we've found over time that that's not correct at all. There's a high amount of neuroplasticity. It's constantly changing and strengthening the connections between different neurons in the central nervous system. And so I think that it's just been a late to the game kind of understanding, and we're kind of playing catch up. I also think that, the way the funding structure is set up out there, there's other focuses that industry has on whether it's a device or a drug that a lot of the research is focused on. And I think pain, unfortunately, can take a backseat to that.
Right. No, for sure. It's also like where I live is quite an aged city in Canada, And a lot of older people in their advanced age. And the focus is, of course, on eyes, heart conditions, and joints, joint replacement, and so on. Of course, the argument, especially in a publicly funded country like Canada, is they can't fund everything, right?
Right.
Okay, so we know that experts almost unanimously advise a biopsychosocial approach, meaning that obviously the psychological and social aspect should be addressed preferably concurrently with the biomedical, and that it can also be, or should also be, a multimodal approach, which means it may include, of course, various categories of treatment, drugs, injection therapy, and so forth. The two barriers, the two big barriers are, I find, is advising interventions that don't sound to the patient as typically medical. I've had a few people who have not had a good understanding, well, quite a few people who don't have a good understanding saying, but I need drugs. This is serious. And yeah, they get that too. But the point is, we have to reverse some of these almost learned behaviors. I mean, two learning theories of pain we already have. And the other one is instilling the idea that apparently small daily interventions are accumulative and can confer massive benefit over time. In fact, I often make the point that these benefits, if done in concert with each other, are more often summative than simply additive. Can you please expand on this?
Yeah, this is sort of a concept I try to explain to my patients. I often see them sort of at the end stage of their chronic pain, to the point that it's been developing slowly over time, getting worse and worse. And I try to emphasize to them, you didn't get here overnight. This took steady steps in a certain direction to get you to where now you're feeling this pain all the time. And you've reinforced your central nervous system in such a way that, this pain, it fires at lower thresholds, it fires for longer, and it fires more intensely. So it's almost kind of gotten out of control and can't be trusted. And in order to get back to where it's a manageable state, it's going to take constant, steady, incremental efforts to get back to that point. There's no single, magic bullet. There's no single treatment that'll take it away. But I encourage them to get an understanding of how they develop their condition they're in, and then how can they work backwards, and that it really is, it's largely dependent on small, steady steps going in the other direction, and that, not to be discouraged. They won't see a lot of gains early on, but with continual small effort, they will make great gains, and that's key to controlling pain over the long run.
Right. And of course, the other thing is that until they understand pain, chronic pain at least, the advice is going to seem counterintuitive to them. Because when something hurts, you kind of you do less, a lot less. And we're telling them the opposites and doing all these things. What has been the most sort of effective way that you've won patients over to the idea that they greatly determine their own outcome? That they eventually will have, and in a way, no matter what physician or specialist or team they're with, that it's largely, we know, active treatments kind of outweigh passive treatments any day. Now, it's obviously a question that repeatedly comes up with physicians, even in the field. Any new innovative approaches that you have come across to secure the all-important buy-in to what they need to be doing? Because it's really lifestyle change, essential, fundamental lifestyle change, right?
It is. And, I created a website, drzarst.com, to try to outline sort of the fundamentals that I think every patient really needs to do to age healthily, age fit, and then also to control their pain. I mean, you're exactly right. We want patients to move as much as they can, not restrict their movement. We want patients to be as strong as they can, not only for muscular strength, but bone density. We want them to keep their range of motion to prevent, restricted movements, and they can maintain their gait and their exercise over time. I can't say I have a single most effective one. I try to tailor it to the individual's condition and then work backwards from there.
Right.
So
No,
without question, I have most common is neck and back pain. So I'll try to make it personal with the patient so that
mhm.
it's relatable. And then I try to encourage them. I use the 1% rule a lot with them. I say, if you just commit to improving your strength and your mobility and your weight by 1% per day, just pick one of those categories, that over 365 days, you could be 300% better than you were today. But it takes that constant, steady push to get them to that
Right.
stage. And I also kind of point out that the body, if the body's gonna regenerate and the body's gonna change in a different direction, it's going to be a constant push of you pushing it a little bit beyond your comfort zone and letting it heal beyond your comfort zone and recuperate. And by making it personal to them and encouraging the small steps, that I hope I can get them to buy in and to stay consistent over time.
Yeah, I think that's excellent. It's so simple, but it's very impactful because by the time one sees them, they've often been going for 5 or more years, right?
Yeah,
So a year doesn't sound like a huge obstacle. I mean, about 1% isn't very much. I mean, it's going to be the rare patient, I would suspect, that would find this an unreasonable thing to accept. 1%. I mean, one can't really go lower than that. So I think that's good. I'm certainly going to try that one out as well because it's a very we're looking at plausibility here, and it's a very reasonable thing to say. So thank you for that.
yes, no, I absolutely. And I try to do that with everything, even with resistance exercise. I say, just give me 20 minutes of solid resistance exercise to strengthen your bones and your muscles. And I don't get a lot of resistance when I say 20 minutes. If I tell them an hour, I get a lot of resistance. But
Yes.
20 minutes, can you give me 20?
Yeah. No,
So we just, and then if we can get them to stick to it, they'll probably do 25 or 30 as time goes on because they're going to notice
yes,
the improvement in their lives.
they're going to. Yeah, and no, there's certainly another thing that helps right at the start. I've found I only started doing this in the last few years. Is they often come with the descriptions very moving of how bad things are, but I tell them we have to move beyond the descriptive phase where we come up with new analogies and where they generally come up, and I listen to analogies and grinding superlatives almost of how bad it is, because that's not where the solution lies. What we have to focus on the future, and you're right. If you give something that's doable and reasonable, it is really hard to say no or to put in little effort.
Exactly.
So as we know well, people in chronic pain typically have the comorbidities or other conditions that generally amplify the pain experience in an unfortunate way. And most notably, these are the sleep disorders, the sleep dysregulation, the anxiety states, major depression, obesity, and all the complication that brings with diabetes and potentially. And then I like to include advanced deconditioning because this is often it's not often cited as a comorbidity, but it includes things like weakness, loss of flexibility, and of course potential disability when they decide it's now at the stage where they can't possibly work. So let's just start with sleep disorders. Which interventions or treatments do you most favor for sleep disorders?
I think the most important thing every patient should be doing to help with their sleep is daily exercise, whether it's cardiovascular exercise or resistance exercise. I think so much of people's anxiety or depression or their feelings could benefit from just an intense 20-minute workout of either one to get that anxiety off your chest, get those feelings of angst that you've had throughout the day, and find an outlet to express those. And then once that's been accomplished, I think, I emphasize to people that sleep's the most regenerative phase of your day, and it shouldn't be treated as sort of an afterthought. And I strongly encourage nighttime sleep routine, devoting a solid 30 to 45 minutes of shutting off your phone, quieting down. I like taking my evening supplement, which has some magnesium and melatonin in it to help bring a calming effect. And then I think you need to get your mind sort of set before you sleep. And I encourage people to do a little bit of, whether they like meditation or gratitude journaling, just documenting something they're grateful for from the day and something they're grateful for tomorrow, and really thinking about only that. Because I think so much of sleep disorders is surrounded by those thoughts that just get brought with you from the day, and it's hard to calm the mind down. And then your mind is wrestling with that while you're sleeping. So the first one, without question, is you've got to give me 20 minutes of exercise, whether that's cardiovascular or resistance, and then treat your sleep as a serious part of your day where the healing goes on. I mean, that's where we secrete growth hormone. That's where we regenerate our bones and our muscles. That's where we kind of repair the damage from the day. And I think a lot of times when I put it in those words to them, they sort of think, yeah, gosh, I never really thought of it that way. And by just adding that step, it's sure is a lot more effective than taking a medication.
Yeah, no, and it's true. We are bombarded by all kinds of sensational news as it is. And, just certainly in the chronic pain context, what we focus on grows, and that's one of the drivers of chronic pain, of course. So ending the day with something positive is major. And then, of course, the big thing as well is all this, as you mentioned, the emission, tablets and the phones and computers and so forth, which has become an epidemic, especially among young people.
Yes.
Okay, so how then do chronic pain patients, now I'm assuming, and I hope I'm not misassuming, the chronic pain patients are like the post-injury patients, or are they not your patient group that are post-injury? Are they not necessarily diagnosed with chronic pain?
No, they certainly are. I'd say the two broad categories would be post-injury or long-term degenerative multiple surgeries, age-related degenerative changes that leads to chronic pain.
Okay. So how do chronic pain patients maximize their mobility and strength? What are you offering?
So with each individual patient, we've got to kind of center around what is their problem area. And so once we know that, I tend to rely on some therapists that I work with a lot and just say, okay, around this injured area, here are the things that you can do, and here's the things that you can't do. But regardless of what your situation is, whether you've had 5 knee surgeries or 3 back surgeries or 3 neck surgeries, a good physical therapist and your doctor can kind of say, all right, here's some non-impact exercises that we can focus on, and here's the things that you can do safely, and here's the things you don't. So that's what I would tell anybody is, anyone with chronic pain has at least met with a physical therapist once and should visit with them more. But physical therapy is not, I go 3-4 sessions and I'm done. It's an educational session. It's a session where you're learning about your injury, and then you're taking that knowledge and you're continuing it going forward. And that's another talk I have to have with people is they'll say, well, I did PT and it didn't work. And I said, what, are you doing your PT every day? And they say, well, no. Hey, this, we've got to maintain these gains. We can't just stop. I mean, and I use analogies about elite athletes and that kind of thing. I mean, every athlete is always training and always practicing. And we got to kind of wrap our head around that when we've been faced with an injury or a chronic pain. This is your sort of sport to deal with for the rest of your life. And there's no reason to get depressed about it. We all have our issues, but you've got to be dedicated and you've got to have a focused routine around that injury so that you maintain that strength, you maintain your gait, maintain your balance. I mean, as you said, I completely agree with you. I think that this sort of disuse atrophy that people get over time is not being talked about enough. Because if you lose your lean body mass and your bone density over time, once you get to the point that you start having pathologic fractures and you don't have any lean body mass, it's hard to reverse at that time. Yes. So I've got to scare them a little bit sometimes if I'm not seeing the connection with the positive aspect. And that's the other unfortunate thing is I have I have the benefit of seeing these people every day, and I just think to myself, man, I wish the general public could see this, because they know they'd be more motivated to do all those things that we're talking about right now.
Right. No, people are often amazed when I say, the home, it's what you do. Get the home exercise program mastered under supervision, and that will make all the difference. It's got nothing to do with the performance of your, at that stage when you get increases. It's not like, it's because you're doing it yourself. That's the magic ingredient. The exercises are the exercise, but active is key. We see people after an accident, they want to go to 4 different physical therapy, well, a physiotherapist, a chiro, a kinesiologist, and so on. And all that happens is they sometimes get given passive stuff. They don't get better. And if they did, they wouldn't be able to decide which therapy worked. And it's punitive going to all these appointments, I would think, right?
Yeah, absolutely.
Yep. If it were I. Okay, so diet must be an important part because it is daily due diligence, and we always on about how everything you do daily is important. So be sure you need to do it, or you're aware of its effects. So current wisdom now, more and more we're hearing a plant-based whole food diet, which I'm not against, basically. But in a world where we have seen many diets being, fated and eventually falling into discredit or disrepute or just disfavor and being discarded, what dietary interventions do you advise?
Well, I think I'm open to a lot of different options, just like you are. I think the diet that a person can stick to would be number one. So some people like plant-based, some people like, the keto, whatever you can do to stay consistent, I'm behind. But the other thing that I really emphasize is I think everybody should do some form of intermittent fasting throughout the week. I think that people have gotten, they eat consistently throughout the day. They have lost the ability to switch from glucose to fatty acids. And it's a great way to lose weight, and it increases your insulin sensitivity. A lot of these processed foods and high sugar foods cause a constant secretion of insulin, which leads to insensitivity. So if I can convince people to do intermittent fasting where they don't eat till noon, at least a couple times a week, if not more, it really helps with their weight loss. It helps with their insulin sensitivity. It allows them to mobilize their fatty acids and lose weight. And then I'm also a big advocate for supplements. I think that I believe in antioxidants. I believe in the free radical theory of aging. And so I advise people, and it also puts people in a mindset. If I can get you to take your first meal with a handful of vitamins, including vitamin C, D, resveratrol, and I can get you to, commit to some sort of whole food, superfood, or nutrient dense meal replacement, I found that the person then is like, well, maybe I should do some exercise since I took this supplement. Well, maybe I should do the stretching. And they're much less likely to go to a fast food restaurant if they just threw down a bunch of vitamins.
And
so I think that there's a lot of benefits to it. And I do believe that our food doesn't have the same nutrient level that it used to. And, I'm busy. I can't make 3 salads a day and be active and work like I do. So I rely heavily on supplements, and I do think intermittent fasting is one of the easiest ways to keep your weight down and to be healthy.
Yeah, no, absolutely. And I also, what I do say to people often, I like Mediterranean. I say, firstly, it's got a few thousand years behind it, and it's enjoyable, so you're more likely to, you're likely, but I agree, supplements and the fasting has proven very helpful for many people, even if it's a 10-hour restriction, right?
Yes.
Or limited to 10 hours, and it can lose weight where they previously couldn't. So it's become a mainstay. And I agree with you. I don't think our food's the same. Any mass production, quality's got to go down. We just know that, whether it's a restaurant or a clothes manufacturer, scale will bring it down. In general, I've got to be careful there because I don't really know these industries, but Yeah, so let's just say the chances are that can come creep in quite easily, right? So
Exactly.
yeah, and I think also just becoming more aware that before people, especially people who are pushed for time, shift workers, single people do this as well. They just, I've got to have something to eat, but they forget they've had maybe three fast food meals a week for the last
Mhm.
month. And this catches, I mean, this got to catch up. There's nothing wrong with a fast meal, obviously, but as a diet, not, can be improved on. Let's just say that. So yeah, I see we need to take a brief commercial break, so we'll do that quickly, and then we'll come back with the rest of the question.
Okay.
Um, it's just time for a quick commercial break. You're listening to Healthscape on Voice America with your host, Dr. Trevor Campbell, and I'm talking to Dr. Carl Zars about empowering yourself either post-injury or when in chronic pain. We'll be right back. Are you satisfied with your chronic pain treatment? Chronic pain experts agree that recovery can only occur when the psychological and social issues, which help trigger and drive the chronic pain, are treated along with the other problems. Medications, injection therapy, and a range of physical therapies may provide temporary relief of symptoms, but they don't actually address the root causes that drive the chronic pain. I'm Dr. Trevor Campbell, a chronic pain consultant and author of The Language of Pain, a self-help book for those struggling with chronic pain. Add this type of therapy to your existing treatment plan and experience the difference. Get your copy of my book, The Language of Pain, on Amazon. And for further direction, there's also the Language of Pain online course available on my website, www.trevorcampbellmd.com. Act now to take back your life.
You are listening to Healthscape with Dr. Trevor Campbell. If you have a question or comment about the show, please send an email to host@trevorcampbellmd.com. Now back to the show. Now, illness should be obviously meticulously avoided. That's always good advice, I guess. But not only because of a person with chronic pain being already having a compromised physiology, but also because any illness generally will increase their pain perception, very likely to do so. Now, when speaking with people with chronic pain, is there any kind of metric? Obviously, no specific metric can be given, but will often be a study that shows that regular exercise above a certain threshold will add to longevity by 8 to 12% or something. Is there any way we can quantify these other, the dietary, sleep, and so forth, these benefits, or is that really not in entire? I mean, it's a difficult question, but is there some sort of crude range one can give that sounds plausible?
Yeah, I'm not aware of anything that could do that.
Mm-hmm.
I haven't seen anything that is really quantifiable and reliable. I think there's so many differences
By
between each
variables.
person and so many variables. I think it would be
Yeah. No.
hard to quantify. But I try to make it as personal as I can. And if you can do that,
Yes.
Anybody can relate to, we want you to be stronger. We want you to have more cardiovascular output. We want you to eat better. These are all things that everybody can buy in. We just have to we have to set them up for success. And I think that's often the challenge.
Right. No, absolutely. Because and a lot of the stuff, could be also, certainly could confound it if you took 4 different interventions. A lot of their change in behavior generally, like even socializing,
Mm-hmm.
things that can't really easily be measured, or it wouldn't be included in the study. Okay. Now, in your bio, you talk about flipping the chronic injury script. Now, I'm always on and on about the chronic pain recovery script, because I do believe it's a script. It's a composite of the patient's disease narrative, what they need to tell specialists in order to get relief from their symptoms, their problems, what they tell family to explain who are concerned, because they feel is dragging on for years. It's based on sort of assumptions and beliefs, sometimes misassumptions that meld into a script.
Yes.
And I sometimes see, I've come across fairly often patients who've, in order to simplify their disease script, have fed their family just because it's more manageable, and their friends very much what they tell the physician, which is all the negatives, because they're wanting relief in a short consultation time, perhaps. I feel that this does a lot of damage, and I get them to look at their script, because some of times you'll see a patient, or they'll tell you, or the spouse, interview the spouse, and they'll say, well, at family barbecues, we dish up his food because, so why do you dish up his food? Well, I mean, he's got this chronic pain, but he can dish up his food, or he can, and if you're busy, the spouse, he can, he can unpack the dishwasher. Just take your time and relax, and pace yourself. And what happens is they get treated by family and friends according to the story and not to the reality. And there was a study a while back showing that the spouses, who are often the caregivers, as we know, who were less supportive of the patient had better outcomes. Relations were often strained, but they tended to do better. I must dig up that study again. I know it was very interesting to me that we sometimes enable, because of our lack of understanding. When I say we, I mean the family and friends, because we don't fully understand what chronic pain is, and that we may be doing the wrong thing, but because our heart's in the right place. And
Yes.
they're often shocked to hear that. And I said, no, that happens quite a lot, actually. Because when you interview the spouse, you get tears, like saying, well, he's got a special instrument in his back that sends off signals they can't manage that, and start crying. So it may be working or not. It may well be working, but the patient's spouse takes it as a sign of severity, which in a way it is. So that's what complicates chronic pain. It's how people react to things sometimes, when the knowledge can't be there among lay people. I mean, they can have insight and so forth. Anyway, I guess the question attached to that is this what you find, or is your population more, the focus is more on delivering, the dietary and the exercise advice, sleep advice, and so forth, therapy?
No, I find exactly what you do. I think that, there's a codependence that develops between the chronic pain patient and either their spouse or some of those around them. They want to be empathetic to that individual, so they try to help more. But with that extra help, their ability tends to decrease over time. Exactly like you're stating. Like they don't stop. They stop walking. They're in a wheelchair. I mean, I can't tell you how many patients I've had where I say, why are you in that wheelchair? And they say, well, he just couldn't walk eventually. He just had so much pain. And I have to just reiterate that, you have to continually push your body. You have to push your body beyond its comfort zone. It's either going to degenerate or it's going to regenerate. Right. And the only way that it's going to regenerate is that if you give your body the stimulation and the nutrition and the pushing it to make it do so. It won't just do it on its own, especially as we get older. So I'm always kind of, we do a lot of interventions. And so I always emphasize, okay, we're gonna do this ablation for you. But after that, that's when I'm handing it off to you. That's when you need to really do these exercises that the therapist gave you. We need you to keep that nutrition going. I need you to keep your weight down. Right. And then let's try to decrease these medications that you're on. I try to show that, there's side effects with all these things, and, there's no magic bullet. So let's see if we can get you off of these medications. So it takes a concerted effort, though, on the part of the practitioners to push them in the other direction that a lot of the medical system has pushed them towards us with that sort of disability mindset. Yes. And we've got to do everything we can to try to get them back on course. And it's challenging at times.
Right. Now, the question that I get, I won't say so often anymore, but it keeps emerging that people with chronic back pain see it as a distinct category. Now, obviously, it's often a large part of the body that's affected. It's axial; things are attached to the spine, and yes, it brings its own. And even the treatments are the actual surgical treatments, obviously, very different and so forth. But they feel that somehow that their treatment should be different from like a painful shoulder from or crush injury of the arm. And because I deal mostly with this psychosocial, um, I just tell them, I said, look, well, from my perspective, it's the same mechanism or close enough. And the same principles are sound because they firstly sound in general health to do more of this, more of that. It's all good stuff we recommending. But do you feel that there is validity in that statement that's possibly being missed?
Yeah, no, I agree with you. I think, and I think people just have to take a step back and realize that all chronic pain, whether it's back pain or a crush injury, all painful signals have an emotional component. And I
Yes.
try to explain. I say, if you stub your toe really hard, you don't stub your toe and have no emotional reaction. Often you're very angry, you're upset. You get a very strong emotional reaction to that. So you have to realize that with the neuroplasticity of the central nervous system, anytime you're feeling chronic pain, no matter where it's from, you're sustaining a mental effect from that. You're reinforcing that emotional response, whether you like it or not. So you have to take a proactive approach to first understand that that's what's happening. And then secondly, focus on it to try to unwind that or unwire it as a result of feeling that chronic pain.
Right. In fact, there's a very interesting anecdote by Lorimer Moseley. You're probably familiar with his work. He's in Australia. I was previously at Oxford, and he was in the outback in Australia and walking to have a swim in this lake, and he tramped on something with his bare foot, and he thought he had pierced his toe with a branch or something. And he thought, well, he's bleeding a bit. He's out in the outback, and he went and had his swim. But then it got worse and worse. And when he went to the hospital, I don't know how they found out, someone found he'd been bitten by probably the third most poisonous snake in Australia. And immediately that realization came, the pain was just like insane. And I found that very interesting. He's a very charismatic speaker and stuff, and he's professor at one of the universities. I forget which one, but it just shows you that how we think about things. It's for me, very graphic illustration of how emotions and cognition, how we think about things and how we react to that emotionally, just the enormous effect it has on pain perception. So I found that very interesting, almost unbelievable, but it was a very interesting anecdote, I thought.
Yeah, that is interesting.
I suspect that there are, well, more than suspect, I'm sure there's a great deal of overlap between treatment of chronic pain and the delay or prevention of age-related decline.
Yes, I mean they're intertwined completely, and
Yes.
so that's why when I have patients in pain and I start talking about all this anti-aging and approaches, well, why are we talking about this? I'm talking about my pain, and it's because pain, as we get older and as things degenerate, we can develop these chronic pain issues, and so everything we can do to slow those degenerative processes and keep our bodies healthy and including our central nervous system and peripheral nerves. We prevent neuropathy if we can. It's all intertwined, and I think I try to emphasize to them there's nothing more worth your while than investing 20 to 30 minutes a day in your health and preventing those long-term degenerative changes.
Well, when I tell it more about the biopsychosocial, I said, it just doesn't sound like your doctor's advice. Firstly, your doctor doesn't have a hour and a half to spend with you as a family practitioner. No way, right? And at least my first consult would be that kind of length of time. And so I said I can do more and probe more. But I mean, if you think about it, what I'll be recommending doesn't sound medical because you're not used to getting that aspect. You've got conjunctivitis, you don't have to go into the psychosocial particularly. But the point is that everything you find that I recommend will be sound health practice anyway, if you don't have chronic pain. So it shouldn't be too much. It's more the shock of hearing something, what, no easy fix, no drugs. Something hurts, we should have something. And they don't understand it's not about, the reason painkillers aren't effective is because that's not where the problem lies. And explaining to them that even where you sense the pain is coming from is not necessarily where the problem is. You know, we know from phantom pain, it can feel where your calf once was that got crushed. And then they start getting the rationale of you know, like, okay, so maybe I should listen to you. Which is helpful, right? Okay, now, what advice do you have for a newly diagnosed chronic pain patient? Now, some say 3 months you diagnose it, or for much earlier than you would suspect for that particular injury. Like we know a calcaneal or heel bone fracture can take almost up to a year, 6 months at least, to heal. So we wouldn't call it chronic pain at 4 months. But I know of a very, very reputable medical institution that on their website, they insist 6 months. They don't, you know, which maybe it's just averaging out all the types of injuries they see. What would you say to a person who's newly diagnosed, whether at 3 months or 6 months? What should they do?
I think one of the biggest issues I see is they have this enormous frustration that it's not going away, and they have in their mind that it has to go away. And I try to, you know, let them know that in a lot of ways, accepting that this is something I'm going to have to deal with is kind of the first step, because if they don't accept it, then they're constantly looking for a new treatment, a new drug, something else to fix it. And if, you know, they can wrap their head around the fact that this is likely to be here for the long term, but what we're going to focus on is managing it, keeping it, instead of a 10 out of 10 to a 3 out of 10, that a lot of times getting that mental shift can really help. You know, they go from hopeless to like, well, maybe I can manage this. And you know, for me, I have a chronic injury from an auto accident, and you know, I've just learned over years that when it starts getting out of control, I know the certain things that I have to do to bring it back down. And so I explained to them that, you know, you're new to this, and if the injury is obviously going to be a chronic injury, let's say a crushed limb, and I think having just an understanding of the physiology behind it helps a lot. So I try to explain how these nerves are like wires, and you know, when you injure wires and the insulation around them, they tend to fire erratically. They fire at a lower threshold. They fire when they shouldn't. And so you know, and then validating that, you know, I believe what you're saying. I understand that it's burning and it's numb at the same time. But this is what happens with nerve injuries, and nerves grow at a very slow rate, but here's how we're going to manage it. And then I try to point them into the positive things that they can do at home. And, you know, depending on the injury, you know, it's surprising how helpful a TENS unit can be for some people that have nerve pain. And that's a cheap, non-drug related intervention that they can do. But the new chronic pain patient, the less time they spend wallowing in it, why me? And when is this going to go away? And the sooner they can go, okay, it is what it is. How do we manage this? I think that's the first step to getting them on the right path.
Yeah, right. Okay. Now, I'll call it insider information on motivation is always welcomed, right? Because we're always trying to motivate people. They are low energy, they're sleeping poorly, they're often weaker and certainly deconditioned and of low mood and anxious, right? All of the above. So I personally find that for me, the biggest motivators are simplicity, meaning doable, not dumbing something down, but making it as simple and as accessible as possible.
There you are.
And the other one is providing a strong rationale for each intervention or practice. So I personally find that simplicity, what I often call doability, able
Yes.
to be done easily, rates highly in motivation, as well as providing a very strong explanation or rationale for each practice. Well, the reason you're doing this, which may sound odd to you, because I can tell by the facial expression, and don't mention that, of course, but and this is why you're doing it. Does that make more sense? And if it does, that's very helpful. But do you find there's anything other than those that really increase them? I think breaking it down, we're making it more doable, obviously, for 20 minutes, and also showing them the benefit that can be accrued if they focus on 1% is very helpful too. But is there anything else? While we
No, I
have,
think, yeah, I think you're exactly right. I do try to emphasize that, what I'm telling you is I'm trying to make this as simple and as easy for you to be successful as possible.
right.
And I think phrasing it that way for them, that you have that in mind, often gets you buy-in than if you're just telling them to do something. That this is the simplest form, this is the essence of, this is the minimum. If you just do this, you're going to notice significant improvement. And then if you feel better beyond that, I encourage you to do more.
Yes.
But if I can get them to just, focus on their nutrition and make at least one part of their day a highly nutritious, supplement-laden meal, then at least that's one out of the many that they're going to have. If I can get them to do at least 20 minutes, then that's 20 minutes that they wouldn't have done. And I try to, tailor it to the individual patient. But I think you're exactly right. If we're going to get patients to buy in and be compliant, it's got to be simple. It has to be achievable. Otherwise, they're not going to be consistent. And I guess that's the big one is consistency is more important than quality, for sure. I mean, I'd rather see them have a 20-minute poor workout than skip for 3 days and then give me really good 20 minutes. I tell them, if just do it. If you don't do it as well as you did yesterday, don't beat yourself up, but try to improve by that 1% tomorrow. And I think those kinds of, phrasing it in that framework has led to a lot more buy-in over the years.
I use the best efforts. I say reasonably, none of us can expect you. You'll have good days and less than good days. You do the best you can. It's liberating. No one's going to be, I even just get them to stretch and do that time. So they've allocated that time.
Yeah.
Because I think it's so much better than nothing. You mentioned earlier about your website, which I don't think people maybe got. If you don't mind mentioning it again, please.
Yeah.
Where they can find the details and any blog or contact details you would like to give.
Yes, my website is drzarse.com. That's DRZARSE.com. I also have a podcast called the Age Fit MD podcast. But the website is laid out in a way that is really essentially what we're talking about. It's all the stuff that I wish I could have the hours to tell my patients that I can't, that I know makes a huge difference for them. And so it goes over all these, intermittent fasting and resistance training techniques with chronic injury and how to get the most out of cardiovascular training in the face of some sort of restriction. And then I have some information on the different supplements that I recommend and why and what they do for your body. And then I have a segment on sort of home things they can do, how to use a Theracane, how to do cupping, how to use an inversion table. And when you put all these things together, if I could just get them to do a little bit every day, you'll have dramatic results over time. I've seen it in my patients, and you and I, both know that it works. And so that's where the resources are.
Excellent. What is the most important lesson you have learned, or outstanding thing you have learned based on the work you presently do?
Well, I hate to keep beating a dead horse, but the most profound is that if we can be proactive and instead of reactive in how we approach aging and fitness and our health, that consistency and those small steps over time is really what counts.
Right.
If we don't, then we suffer these degenerative changes, and then eventually we get to a situation where we need some sort of medical intervention. But if we can be really cognizant about, I'm the one in charge of my health, and I'm the one that's going to make the biggest difference, much more than any doctor or any procedure is, then that individual is in the right spot. And so it's interesting in that I think with practicing medicine over the 20 years, I've come full circle. And when I started, I sort of felt that we were probably the most important in medicine, and actually it's the patient. And
absolutely, and it's all of we sort of the Sherpas and the coaches really in chronic disorders, especially. I think that's excellent. Dr. Z, this has been wonderful, most lucid and insightful. Glad you do the work that you do. It's an important work that often falls through the cracks in general practice because there just isn't the time to do it properly. And, yes. Traditionally, I think chronic pain patients have had a hard, a raw deal, basically. I'll put it the way I think. And anything we can, I think they can just bring in the universities, undergraduate, just what it is. And this is your going out point, your exit point. When educate yourself in this, because people don't know this, and the add-ons will, because doctors will intuitively know which trajectory or direction health lies. You've been listening to Healthscape on Voice America with your host, Dr. Trevor Campbell, speaking to Dr. Carl Zars about empowering yourself when you're in chronic pain or injury. Thank you.
Thank you, Dr. Campbell.
Thank you.
Thank you for tuning in to Healthscape with Dr. Trevor Campbell. We hope you'll join us again next Wednesday at 3 p.m. Eastern Time and 12 noon Pacific Time, or listen anytime on demand on the Voice America Health and Wellness Channel. Have a healthy week.